Rats have lived beside humans for thousands of years. Where we store food, where we build homes, where we leave waste, rats follow. And sometimes they carry more than sharp teeth and quick feet. They carry disease. In history, rats and the fleas they carried helped spread one of the deadliest pandemics ever recorded, the Black Death, a plague that killed millions. Today, rats still carry dangerous infections, viruses that move quietly through villages, towns, and cities. One of those diseases is Lassa fever. This episode is dedicated to the healthcare workers who lose their lives every year while caring for patients with Lassa fever. Before we go further, a small clarification. Rats belong to a group of animals called rodents, which also includes mice, squirrels, porcupines, and beavers. Rodents vary widely in size, but rats and mice are among the most common ones that live close to humans. The rats people most often encounter are the brown rat, Rattus norvegicus, often found in sewers, and the black rat, Rattus rattus, commonly known as the house rat. They live in homes, markets, drains, and storage areas around the world, but in many parts of Africa, another rodent plays a far more dangerous role in public health. Mastomys natalensis, known for both its rapid reproduction and its role in spreading Lassa fever. Mastomys natalensis, also called the multimammate rat, is the main animal responsible for spreading the Lassa virus. At a glance, it looks like many other small rats. Even experts often need laboratory confirmation to tell the difference. There are subtle clues, however. A slimmer body, a pointed face, slightly larger ears, a long, thin tail, and plain brown fur. Nothing that clearly signals danger. What truly sets Mastomys natalensis apart is its reproductive capacity. It has multiple mammary glands, typically 8 to 12 pairs, sometimes more, unlike most rats that have about 5 to 6 pairs. This allows it to produce large litters and breed frequently. More rats mean more opportunities for the virus to circulate. The Lassa virus is invisible to the eye, but within populations of Mastomys natalensis, it circulates continuously, for example, through contact with urine and droppings, grooming and close contact, bites or scratches, and contaminated nesting materials. Infected females can also pass the virus to their young during pregnancy or shortly after birth. This allows the infection to persist across generations. Inside these rats, the virus causes little harm, but it is shed in urine and droppings, often in tiny, invisible amounts. This makes Mastomys natalensis a reservoir host, an animal in which the virus can live and persist in nature. Note that other rodents may occasionally carry the virus, but they do not play a major role in maintaining it. Mastomys natalensis remains the primary reservoir. Humans are accidental hosts. Now the story moves to the kitchen. Garri, dry roasted cassava granules, is widely eaten across West Africa. It may be mixed with hot water to make eba, which is then eaten with soup, or it may be consumed raw, soaked in water, sometimes with sugar or ground nuts. But it is often stored uncovered. And at night, rats move. They walk across everything. Their urine and droppings can contaminate food or kitchen surfaces, becoming tiny particles that may be swallowed or inhaled. Garri, rice, beans, crayfish, or any stored grains left in open bowls or sacks can become invisible traps. Even market-bought Garri may become contaminated before it reaches your home. And it does not stop there. Rats may climb over open plates, cutlery, canned drinks, or foods like malt, sardines, and baked beans. When they do, they leave urine and droppings behind. Once the urine dries, signs of contamination may no longer be visible. The utensils may appear safe, the cans may look untouched, but invisible contaminants may be present. Take action. Store food in tightly sealed containers. Transfer grains immediately after purchase. Use plastic drums with tight-fitting lids or other rodent-proof storage options. Store plates and cutlery properly. If utensils may have been exposed to rats, wash them again before use. Clean the surfaces of canned drinks and packaged food before opening. Always keep storage areas clean and dry. After entering the body, the virus does something deceptive. It waits. For 2 to 21 days, a person may feel completely normal. No warning, no obvious symptoms, then the body begins to change. Fever, weakness, headache, sore throat, vomiting. At first, it may look like malaria, common, familiar, easy to dismiss. But in severe cases, the illness turns dangerous. Bleeding may occur from the mouth, the nose, the gums, or inside the body, because the virus damages blood vessels and interferes with clotting. Breathing becomes difficult, organs begin to fail. Lassa fever belongs to a group of illnesses called viral hemorrhagic fevers, which also includes Ebola virus disease and yellow fever, meaning the symptoms may overlap, even when the illness looks less severe at first. If fever persists, especially after possible rodent exposure, seek medical care immediately and mention that exposure. Early action saves lives. Severely ill patients require close care, but the virus spreads through body fluids, blood, saliva, urine, vomit. This is why doctors and nurses use protective equipment, gloves, masks, gowns. Even with precautions, outbreaks sometimes claim the lives of healthcare workers, people who were simply trying to save others. For anyone in healthcare or caring for the sick, always prioritize hand hygiene and personal protective equipment. If detected early, Lassa fever can be treated, but timing matters. Treatment works best in the early stages. Supportive care, fluids, pain control, and organ support is also essential. Persistent fever requires prompt medical evaluation. Early action saves lives. Prevention is the strongest protection. Store food in tightly sealed containers. Transfer grains into rodent-proof storage immediately after purchase. Keep plates, utensils, and kitchen surfaces clean. Wash any item that may have been exposed to rats before use. Clean the tops of canned drinks and packaged food before opening. Block entry points for rodents and seal cracks in walls and floors. Dispose of waste properly. Avoid direct contact with rats or their droppings. Reduce rodent populations safely through approved traps or pest control measures. And support regular community cleanup efforts. Small actions break the chain of infection. You are the guardian of your home's health. A tiny virus, a fast-breeding rat, an ordinary kitchen, a bowl left uncovered, a plate that looks clean, a surface that seems safe. Small things, ordinary things, woven together into a chain of risk. But that chain can be broken because the greatest danger is often not the virus itself, but the small risks we overlook. The uncovered food, the unwashed surface, the unnoticed signs, the delayed response. And the solution is just as ordinary. Seal the food, wash exposed surfaces, block the rats. Act early. Knowledge is not just information, it is protection. Share this message, protect your home, protect your community.